2, 1. Okay, give me 1 second to get situated. They're not curls. They're
Okay.
huh?
Nothing.
They're rollers.
Rollers. Sorry, whatever the correct term is.
Yes, they're
I,
rollers.
and you're centered on your end.
I'm centered on my end. Are you You're centered on my end.
Okay, perfect.
It's
I'm only
it's
seeing
really
half of
up
you.
close. I can see from your glasses like up.
Really?
Yeah. I don't know if you want to zoom out a little bit. It's fine.
Is that better?
Yeah.
Perfect.
It's organic. All right, friend. Thank you for coming on
Yeah.
Princess and the Pod. I haven't seen you in 10 years.
Yeah. Crazy.
I know. I'm a little sad and a little bit upset.
I think I was in San Diego.
You
2
were in
years
San
ago.
Diego for the oral surgery conference,
Yeah.
and then a bunch of people drove down to see you, but it just so happened that Chuck and I were going to bone grafting class in
Chicago.
and we saw Chris and we saw Schaefer, and so it's just kind of like a flip-flop where we all missed each other. Yeah. It's sad, but it's understandable. Oral surgery residency is stressful.
Yeah.
It's fine. I just interviewed Kyle yesterday, and he reminded me that it's our 10-year reunion coming up
Yes. Yep.
in
Which
2
is
weeks.
wild. It's crazy. I can't believe it's been 10 years.
I know.
That's just wild. That seems crazy.
What's even crazier, so I'll do a brief intro for those that don't know Derrick Nelson. Apparently, even though you're not on now you're on social media, but back in the day, you were like low-key, under the radar, no Facebook, no Instagram, nothing. You just went to school, you did your thing. You were our class president, super involved, which we were all thankful for. You were a great class president. We had a great class, but you were also an awesome leader. But you had no social media until recently. And I just interviewed Kyle Polson, who's kind of like me, a little bit more social, bubbly, outgoing, and you just started an Instagram, which was interesting.
Yeah. No.
How did that happen?
So the group that I'm joining, they basically brought it up to me like, hey, what do you think about getting on social media? And things have really changed. I mean, we had social media and stuff when we were in dental school. I mean, yeah, it's coming up to 10 years, but it wasn't that long ago. And I think like just the avenues by which people go to receive information, the way you kind of expose yourself out there as a clinician. I think traditionally it's probably done academically through papers or lectures or conferences, which you still have some of that. But I think the majority of our generation is, usually kind of learning stuff on social media. So they kind of brought it up as, think of it as something that's more personal, like a family category. It's also part of the professional development as well.
It's wild. That's exactly how I looked at it. So it was in residency when I started my Instagram page, and it was because of my residence, and I was really against it. I didn't want to do it. I get really distracted easily, and it just felt like a distraction, and I didn't want to do it. And they had a good point. My residents were like, we know you, but other people don't know you. So other people should get to know you. So I looked at it like a educational tool in the beginning. So that was, I had the same feeling when I got started. So let's talk about oral surgery. I don't know. Some people know oral surgery and perio can kind of beef a little bit, which is interesting for me because I have a lot of OS friends, and a lot of OMS are coming on the podcast, you included, but you always knew that you wanted to do oral surgery since you started, I think. Like you went in with the intent to become an oral surgeon. So can we talk about that? What was the driving force behind that? Because I think a lot of people think, I want to do ortho, I want to do oral surgery. And then you realize there's all these other things that are in dentistry, and a lot of people change their minds, but you were always really like laser focused on oral surgery.
Yeah, I think I always just like cleft craniofacial. I like more facial reconstructive surgeries. I like the restorative. It's kind of, a funny term to use, but I like the idea of restoration, which is putting someone back, to what they had. So it's not just like thinking of like a filling or a crown, but like, a smile, whether it's like something cosmetic or aesthetic, or as well as, an implant or jaw surgery or whatever it is. So I always kind of enjoyed that. I actually really liked ortho in dental school, and I used to go to the ortho conferences in the evenings. They were like at 6 or something, and I think I finished with like the ortho honors track. So I did a lot of like, I did a lot of that stuff, but it was really ortho that kind of solidified it for me, because when I went to the ortho conferences, I saw what ortho did and what surgery did, and I was like, man, I really like the surgery part. And I kind of like the whole medicine aspect to it, the path and all that stuff, how you still kind of kept some of those things. You're doing all the other specialties too, but for oral surgery, it's like, it's a central part of it. So I kind of like that part of it. And then as I started to hang out with the department more, the chief residents and the residents at the time were, very kind and let me come and shadow. Went to the R with them a lot. I took call a lot with them, and that kind of solidified it as more of a calling for me.
Yeah, you did hang out in ortho a lot, but I feel like ortho and OS are really, and even perio from the soft tissue aspect, it's all kind of merged together, which I feel like
Yeah.
it's not intentional, but dental school just doesn't really do a good job at explaining and teaching you that what we learn in dental school, it's just scratching the surface. Like it's
Yeah.
just such a small piece of what dentistry really is like.
Yeah, the irony about specialties is like, historically you'd have, whether it was in medicine or dentistry, you'd have people who would practice all these different things, right? Like there wasn't really like a partition to that. And as a group of them started to hone in on a specific part of the specialty, then a specialty grows out of that, right? So, practitioners were doing oral surgery and perio and ortho and peds, and then people said, I just want to work on kids. So they started peds or whatever as it started to go down the line. Well, surgery is a little interesting because it was originally like part of medicine. And then it became part of dentistry. And then there was like this tug of war between both. Like, and then perio kind of grew out of that. And then the whole like rivalry thing started happening, which I don't even know why that even exists, but whatever. It's a thing. And
Wait, what
um
robbery?
like we've seen like perio and oral surgery. It's just
Um,
like, for a lot of practitioners that they'll bring, like in residency, it's like, oh, perio and oral surgery is like a turf war thing.
we
And
got.
yeah, but it's like when you really start to sit down with each other, you realize how much you can learn from each other.
Mhm.
And that's the part that's so ironic. I don't think anybody came up with these specialties so we could be in silos.
Right.
Like it's because people were in a multidisciplinary setting that they started to break off into specialties. And then like the specialties became like a turf war thing. Like it wasn't intended to be that way.
That's what's hard, right? So I think the difference between us and medicine is in medicine, you can go into primary care, which we have such a shortage of primary care, internal medicine. But at the end of the day, most of them are not owned by their own group or in private groups. They're in the hospital. So they can talk to each other. They have the same software, they have the same system. Versus for us, we're just, like you said, in our own silos. So the communication between everybody, and as a general dentist, you can do as much as you want from doing zygomas and implants and ortho and be a super GP, or you can just focus on bread and butter, as we call it. So it's just, yeah, we definitely, we don't have to go into the history, but we got
Yeah.
kicked out of medicine in a way. And then now that we're learning more about like systemic links, heart disease, diabetes, all that, I think people are understanding how everything's connected, especially for me with oral surgery and ortho. Airway is so important. It affects
Yeah.
everything. Your
Yeah.
breathing, your sleep apnea, your posture, it's all connected. So it's interesting that we all got separated in a way.
Yeah. And I think like, when you talk about, there's this thing that we say, who's the most important person in the operating room? And whenever you ask like, the interns are visiting students, it's always like, oh, is what do they want me to say? Is it the surgeon? Is it anesthesia or whatever? But like the most important person is the patient, right?
Exactly.
That's the most important person. And so when you're talking about working together or a multidisciplinary approach, like that's what matters, right? I think my road's a little unique because I was a general dentist for 4 years. So that's why it's like my road was so long after dental school. So I spent 4 years of being like the primary person and then referring to all these different specialties. So then I saw like the roadblocks or some of the systems that were put in place that were pretty good, like from that side, right? Like I was the one that was dealing with a patient who was like, I tried to call this person, I couldn't get in.
Right.
It's a 3 month wait. Like I'm the one that's seeing them all the time, right? So I remember all those things going into the avenue of becoming a specialist. And like that's why for me, even in residency, people would have like my cell phone number. I'd be like, okay, you haven't received a call in a week. I'd make sure you get a call. I'd go to the coordinator and be like, hey, this person needs to be added on for Wednesday at 10. And I see that person and I make sure they get in because I know both sides, like their
Yeah.
dentist is out there in the community. Like, dude, I sent this implant like 6 months ago. Like they're literally growing teeth. at this point.
Yeah. Like we have stem cells for that. You know what's interesting is there's one oral surgeon in particular in town that I work with, and I specifically work with him. I don't like trauma. I love how you say like I want to put you back together. I get it. For me that's more on like the orthopedic side, right?
Yeah,
Perio can dolly a little bit. For me, it's more like on the plastic side.
yeah,
And so like, is it really an emergency with perio? It's a chronic disease. So it's
yeah,
a little bit different. And there's one oral surgeon that I work with because he does trauma. He's at the hospital. He squeezes patients in. Like it's that urgency for OS that you need to, it's like emergency and ortho combined in one. Like you got to get them in as soon as
yeah,
possible.
absolutely.
So
Yeah,
you practiced as a general dentist for 4 years.
yeah, 4 years. Yeah.
Wow. Did you
Yeah.
like it? Did you enjoy it? How was it?
I mean, what I liked about it, I mean, I liked the experiences that I had. I didn't enjoy general dentistry. I'll be honest with you. I felt like I was, kind of capping out. And now, full disclosure, like I was in the public health, because it was a repayment for dental school, so I was in
Yeah.
that setting. So my patients also had a lot of limitations as to what they could afford. So it was like I was referring a lot because, like, once the patient, they came up with the funds and they can do that. I just didn't have the resources to do a lot of those things.
Right.
But I do see the importance of having like a sound general dentist. Like for me in residency, when a patient would come and say, I want an implant or I want, these things done, I want to get my teeth out and I want to get dentures. I'm like, no, who's your general dentist? Like, what's your regular like hygiene appointment? I mean, if you're not seeing somebody twice a year, 4 times a year, I'm not placing it. You know what I'm saying? Because it's
Right.
like you look at it and you're just like, okay, well, there's enough, mesial-distal space, interocclusal space, buccolingual space, good keratinized tissue. I'm gonna drop an implant in, and then this person like doesn't have a clue about the hygiene,
Right.
and now you gave somebody like a Mercedes and doesn't know anything about maintenance.
Right.
Like
Exactly. Oh yeah, yeah.
it's yeah. So
That's a good analogy
that's
for
a
sure.
huge yeah. That's really huge for me. Like patients have to understand that I'm not here to like play Mr. Potato Head and just start plugging things on and off them.
Yeah.
Like you need to have like a name and be a person and have a plan in place. And I'm willing to be part of that plan. I'm willing to help you get that plan. But I'm not just gonna go start doing stuff on you and you don't know what you're getting into.
Exactly. I was having that discussion with an orthopedic surgeon, and they're like, why don't we just rip everything out and put implants in? And I was like, listen, we use the same titanium. Some of the companies are the same manufacturing companies. We can do that, but it's not. And they're like, well, I can't get a cavity. I'm like, no, but it would be like you have this titanium metal exposed to everything. You still got to clean it. You still got to go to these
Yeah.
appointments. Like it's not an easy fix, but I think that comes from marketing. And when we first started doing implants, and you and I both went to the same dental school together, which was one
Yeah.
of the cornerstones within implant dentistry. But
Yeah.
after we started doing implants, I think we failed in a way in explaining to patients like this is not a forever thing. You're lucky if you get, I tell patients 10 years. I'm not sure what you're
Yeah.
saying to
Yeah.
patients.
I mean, I don't even put an age limit on it, but what I usually, back to your orthopedic analogy, which is really good, right? Because this is the issue with, I don't say like a limitation, but just having an open mindedness to understand the different specialties, right? So yeah, our materials are the same, but there's one major thing about our field versus like orthopedics, right?
Yeah.
They put implants in a closed environment, right? They stitch them back up, and there is no exposure to the outside environment. There shouldn't be. At least there shouldn't be. Your hip or knee should not be exposed to the outside environment. But for a dental implant, that's happening every day, right? Like my orthopedic appliance in the jaw or bone is exposed to bacteria every day.
Mhm.
I can't keep them on antibiotics for the rest of their life, right?
No, no.
So you're right,
Yeah. And then, there's all the systemic links and everything. So you started an Instagram page recently. I like what you've been posting. It's very inspirational for residents. So it seems like you're still continuing on the path that you had before, which was mentorship and coaching and like leadership. So what's your journey been like now in residency and then working with people who want to be an oral surgeon? And we've talked about that too, because a lot of people think they want to do a specialty or do OS or, ortho, whatever whatever it is, but you're posting really positive tips. So I want to hear about that and kind of what you've been sharing lately.
Yeah, for sure. I think when looking back, I got about a month or so left for residency. Looking back at it, there's some things that I wish I did a little better. And so that's why I'm like sharing some of those things. So I think it'll be beneficial for those who are moving forward. But there are some things that I didn't like, which I did try to implement this year, being in a more of a leadership role. And I think, having more of the camaraderie, not kind of tearing somebody else down, figuring out what somebody's like self-specialty interest is. So like I have some residents who are like, they're really into research or they're really into like the orthodontic stuff, whatever. Like I make sure they get plugged in with that. Or
Yeah.
if we have a study club or something, I make sure that like that's like their thing. Somebody's more into dental alveolar, I make sure that like they get assigned stuff for that because that's their thing. Because there's a difference between like synergy and like energy.
Yeah.
Energy you can burn out because it's like coming from you, but like synergy comes from those around you, like the marathon runners. Like if you run with people around you, it's totally different than working out all by yourself. Like you'll burn out way faster if you're all by yourself. So I think I've always kind of been a person that's like, okay, how can I help someone to, be the best that they can be? And ironically, it ends up helping me. Like it always helps me to become the best that I can be. Similar stuff from dental school, where it was like, I found that instead of being like, oh, I've talked to people who are struggling with dental school, and instead of focusing on that, focusing on, okay, what's your area of interest? How could you be in the role of helping someone else? For some of the people in our class that like were struggling, I'm still proud of the fact that most of them are specialists. They ended
Right.
up doing residencies. They ended up doing very well. You doing very well in practice and everything. And it's like, to me, that's more important than any award I've ever gotten. Like, there are no awards hanging in my home or office. I never will hang them up. Like, that's like a personal thing for me. But what means more than anything is like seeing someone else on that journey reaching like their goal or dream. Like that's what matters to me.
I know, I get that. That hits home a lot. I have my diploma in the office and a couple of words. We can probably different podcast episode because I'm going to make you do another one, like talking about imposter syndrome. Like you just
Yeah.
don't get, we get the awards and we get the accolades, but there's other things that matter that are more important, right? For me,
Yeah.
definitely, I struggled in dental school for lots of different reasons. You helped me a lot in a lot of different ways. And yeah, I would have never thought I would have done perio and doing so well. For me, one of the biggest moments happened a couple years ago. There was a like top young implant clinician award, and you're just like, but it was in Spain. But what mattered about it is that I didn't just get this award, but one of my residents got the award. So I was like, it's about passing it down to other people and sharing our knowledge with other people and like helping other people. That's what's important. But I will say, you did assign me this job. I don't know if you remember, but we had a vending machine downstairs when you walked in through one of like the side entrances, and you like somehow convinced me that it would be a great thing if I was the one who stocked this like vending machine and then collected all the cash, counted all the cash, and we had the cash for I don't even know what we used it in our class. Do you remember this?
Yes, I do. I do remember. I remember the vending machine too. Yeah, but
Yes.
and one of the reasons why I assigned you that job is because a couple months before that, I remember having a discussion with you in the hallway. If you remember, you were by your locker and you were like, "I don't know if I can do this." Right? Like it was about dental school. I remember you were in the hallway, and I came and you were just like, "I don't know if I can keep doing this." And I'm just like, we've got like 14 more quarters to go. Like you have to. This is like pretty early on, right?
Yeah.
But I think when you like focus on yourself and what things look like around you, it's harder to see your full capability than if you have like a task or something that you're given, right? Because like all of a sudden, if you if you take someone and you put them in charge of something and they have to be accountable for something, you draw out of them things that are already inside of them.
Machine.
I mean,
I had to do the vending machine. Listen, like, no, in my defense, my dad was going through cancer. My uncle
yeah,
also had cancer. I was far away from home. I don't know if you remember.
yeah,
Yeah. So lots of different things. For me, that's what I try to tell my pre-dental students is they're focusing on the grades and the end goal, and it doesn't get easier just from being in private practice, doing a startup, opening my own CE company. It doesn't get easier. The way you cope hopefully gets better, but it doesn't get easier. It's just
yeah.
different.
And so it's funny that you asked like why I ended up doing this Instagram thing. It's like as I started to talk to people one on one or share experiences that I had in dental school or that I had, more of like one on one conversation because I'm not really a social media person. I'm not
Right.
like I've never I don't even know how to I hardly know how to use the thing. I've texted you and asked you for help. Like let's be honest. But like I think people who saw that were like, hey, think about doing that on a level where you're impacting all these other people. And you're like, you're never going to be able to talk to someone in like DC and LA and New York and Texas, like all at the same time. Right. And I'm like, oh yeah, I never thought of it that way. And
Yeah.
so it's like, okay, well, if it's going to be helping others, because one of the things that we talked to our media team with the practice, I was like, hey, if this is going to be about me, I don't want any part of it. I told them straight up, I don't want any part of anything that's going to be highlighting and focusing on me. It's got to be able to focus on either the process of what I had for the sake of others. That's just my personal rule, and it's been working out. So we'll see.
Yeah, that I think that's a good outlook on it. That was exactly what my residents said. They were like, you help us, and I we both of us were known within our bubble, right? But
Hmm.
then you can have a bigger reach to help other people, which is I think what a lot of us in our class enjoy doing. And then like you said, you get to meet other people from different trainings because we go to our residency program, we learn from our attendings, and so we can only learn so much. But then imagine, yeah, somebody from the East Coast who had a totally different training. It builds up your skills, and then from the patient standpoint, you can help more patients that way too.
Yeah,
So
yeah.
it's pretty awesome. Also, we have a lot of mutual friends in common, which has been really confusing for me.
Yeah, 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 yeah. Well, that again, that's because in my residency or most OMFS residencies, you don't get a lot of the soft tissue stuff, especially with dental alveolar.
Yeah.
And I was like, well, I got to get this right. Like, I can't come out and have that excuse to patients like, well, I didn't do a lot of this, so there it is. Even if I'm not personally doing it all, I need to understand when it needs to be implemented and when to call for help, right?
Yeah.
Or when to like you got to be able to put yourself aside, put your pride aside for the sake of the patient. And so I have talked to, like I've shared with you, a couple of your perio, friends and mentors and stuff that have been very helpful to me. And I'm like, dude, you got to help me out here. Like, help me understand this concept. Help me understand how you do this. And they've been really open to help and share. Same with the perio residents. We've had a great relationship this year at UNC and vice versa, right? Like they've come to us about certain things, and I'm like, yeah, I'd do it this way or do it that way, or
Mhm.
medically, I wouldn't mess with that person, maybe in this situation. So, I think there's a lot to be gained in competition. There's a lot more to be gained in collaboration.
Exactly.
Always. There's never a time in history where competition outpaced collaboration. Never.
Exactly. I have the same mindset. A lot of people don't. Maybe it's where we did our dental school. Maybe it's how we were brought up. I have no idea, but I have the same mindset. I remember when a friend whose OMS moved from East Coast to San Diego, and we just knew each other from social media. And we met up, we went to lunch, and I was like, okay, these are the general dentists in town that I know. Ortho, like, go talk to this person, go talk to this person. This person likes this person like that. And he looked at me and he's like, not a lot of people would do this. I'm like, listen, I don't see it as competition. If anything, we can collaborate because there's a lot of stuff that I do that you don't do or that you do and you need help with or vice versa. I don't see it as competition. I think the more that we can collaborate, the better. And we worked together for years till he moved out of San Diego and opened up his own practice. So
Yeah.
it's always good. And I'm always thankful because looking back at dental school, you think about we were all in a bubble, right? But
Yeah.
these people go out, they go to different cities and towns, and I still get a lot of referrals from people that I knew in dental school. And so I think just being nice, being kind, and helping people, it goes a long way versus the other type of mindset that some people can have.
Yeah. I mean, and I just feel like, having that other mindset, that we're kind of alluding to, it's just such a stressful way to live. Like I
Yeah.
just don't have, I don't have, I'm not it's not that I like we're weak or we're not able to compete or we didn't go through and do all the studies and exams to be like a competent provider in the community and outpace other people. But what is the point of that? Right? Like that the point of succeeding that way is for me. It's not really for the patient. Right? Like I want to outpace you and win patients so I can beat you. It doesn't give a damn about the patient.
Right.
You know what
Right.
I'm saying?
Right.
So it's like if it's like, hey, I'm starting to see a lot more of these cases. You're really good at them. You're backed up. I need to kind of do this more. can I work with you on this? Is there a study club I can go on? And one thing that I did, the guy I'm going to go work for, Dr. Ryan Cho, he's practices in Asheville, North Carolina. And one thing I thought was really good that he did when he first came to town that I kind of took after is I met with the oral surgeons in town, the other oral surgeons, one of the main groups that are in town, quote unquote, our competition.
Sure.
And some of those guys like mentored me and stuff when I went to either lunch or dinner with every one of them like individually. And I was like, hey, I'm coming to town. I'm a young new surgeon, obviously recently graduating by the time I start. Like, I'm just here to help, and like if I see somebody come into the practice, what you're gonna get from me is I will never like badmouth you or say, hey, you know what, come here because of this. And I actually don't do the same thing for me. If there's anything you see of mine that shows up in your practice, like let me know just so I can get better. And like anything that comes to me, I'm gonna reach out to you first because there could be a misunderstanding. And I was like, hey, if a patient has a misunderstanding and it's something like I think you can address, I'll try my best to get him back there. And like I think that's more fruitful than like let me come to town and outpace you with referrals. Like
No, that is that I hope that everybody that's listening just takes note. I have been the same way. It's colleague to colleague, professional to professional. You pick up the phone, you call them, hey, I've
yeah,
had this patient, and it's just having each other's backs and camaraderie versus that other type of mindset. I agree. I hope everybody's listening to that. I think it's so important. But it's a mindset, right? So
yeah.
okay, so as we wrap up, you talked about your next chapter, the next steps. You're joining a private practice. What's that look like for Derrick, and what's in the future for Derrick?
Yeah. So I'm going to be finishing up at UNC Chapel Hill, and then I'll be moving kind of about 3 hours west, 3.5 hours west to Asheville, North Carolina. So we got one practice that's already up and running there, possibly getting another one going, and it's a great practice, a good family environment. I think the most important thing, and this is what I think people should really consider, that gets like it's not appreciative enough when looking for a job is like practice philosophy, right? Like the guy I'm going to go practice with, we have the same, very similar practice philosophy, right? Like the things we just talked about is what matters to him. And I think looking forward to being part of the community as a clinician. Again, I've never been an oral surgeon in the community, but I have been a clinician in the community. So looking forward to getting back to that after 6 years of training, but also in this new role. And it's strange to be like coming out into practice new again. I feel like I'm doing this twice,
Yeah.
because like at one point I was like right out of dental school and just moved to North Carolina, and now I'm like this guy that's like brand new out of surgery, but like a new again, but still
Right.
having all this experience. So looking forward to that and being part of the community and helping to shape it.
I'm excited for you. I'm excited for this next chapter. I'm sure you're going to be sharing it with us on social media, and
Yep.
hopefully, please do. Like I said, I interviewed Kyle yesterday. His episode will come out Monday. Kyle did say I was the best babysitter that they ever had.
Yes, you were. Wait a minute.
Uh,
Sarah Goodacre is probably going to hear this. Boy.
I love no. Me and Sarah are great friends. Sarah was also we just had a different way of approaching things. Sarah
Right.
was on it. Like she had coloring books, she had a plan, and I was just like, hey, I'm here.
Yeah. I don't
Not
know.
not much
Kyle's
has
pretty
changed,
bald.
I will say.
Kyle's pretty bald. I'm not going to go that far. I'm going to get a text from Sarah.
No, she'll probably text the both of us, and she'll be like, "What the heck, guys?" But I told Kyle like we were very blessed. We had a really great class. I think a lot
Yeah.
of us helped each other. We were a family. We had that like it wasn't even a growth mindset. Just I we all went through a lot of things like personal things, emotional
Yeah.
things, and it just seemed like we all moved forward together. Obviously, we were in the best clinical group, so we had a huge advantage when it
Yeah.
got to clinic with Dr. Young, Dr. Cochran, Dr. Etsy.
Yeah.
It I if I could go back and choose a different school, I would not. I don't know how
Yeah.
you feel about it.
Same here. 100%.
Yeah.
100%. I mean, I think looking back, I mean, because you only know what you know, but looking back, like the experiences I had in dental school, the opportunities that we had just clinically, I
Right.
mean, it's just there is no match compared to what we had and the great minds and clinicians that we had. It's crazy. I mean,
Right.
it's just yeah,
It's wild. Compassion clinic. We would all go to the homeless
yeah,
shelter, do work Tuesdays and Thursdays. We'd be there till 11, 12 p.m. Wake up, be on clinic, and we had so much experience. I've met a lot of my students, and other clinicians where they didn't even do endo in dental school. It's crazy.
Wow.
Mhm.
Yeah, I've seen people graduate like, under 100 extractions or 50 extractions and dentures, but never set the teeth. And
Two
it's
crowns,
just,
no
yeah,
no
no,
lab
it's just,
work, and I'm like,
yeah,
oh
it's crazy.
gosh, we were grinding it
Yeah.
out. Yeah.
Yeah, 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 yeah. It was like part of the and I think all those things, I mean, granted, some of those things may not be practical for the day to day, but at
Right.
least having the appreciation for knowing that and understanding like, the process. There's
Yeah, and
definitely
they've
something
shifted.
about
Now they're moving more into digital. So that kind of leads me into my next thing. I asked two questions when we close the
yeah.
podcast. One thing, something that people don't know about you. It can be a hidden talent, maybe your favorite food, something that most people don't know about you.
Okay. Something most people don't know about me, man. It's funny, like I'm pretty private, so I feel like it should be easy.
I know.
But I feel like a
Like I
lot
can
of
think of like
people.
five things.
Yeah. Oh, really? Yeah. I mean, I think maybe people should know about that. Oh, I do have a car addiction. Maybe people know that.
Car?
I don't know. Yes. Yeah.
What?
Yeah, I do. I have a
Since
problem.
when?
Cars? I've always had a car problem. Yeah. Yeah. But in dental school, you can't afford anything. So
I'm like,
it's not,
you had car problems in dental school.
yeah, 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 yeah. No, I have an addiction to cars that, yeah, it's a pretty expensive hobby.
It's an investment the way I look at it.
Yeah.
That's pretty cool. My dad's the same way. That was my husband's like big splurge was a car, and we went back and forth. I'm like, dude, you're going from driving this like 20-year-old Audi to this car, like, but whatever. I he has the car. And then who would you like to see on the podcast? While you think, you made me think of somebody, Dr. Juan. When we were talking about
Yeah.
dental school and all the like stuff that we had to do, I caught up with him recently, and I was like, actually, I need to get him on the pod. But you have to come up with somebody,
Oh, man, yeah, because I was gonna say that's a good one actually.
right?
Um, have you had Dr. Esty on here?
No, do you think you would?
I think you would. Yeah, I think you would.
I would love to have Dr. Esty on it. Him and Dr. Richardson tried to get me to stay and do pros after perio, and they were having,
Wow,
you know,
cross after perio?
cross after perio, and they wanted me to stay, and it felt like such a huge honor. And then they'd see me, and Dr. Estes like, he doesn't talk to, like, he doesn't tell people this all the time, like,
Yeah.
if he's telling you to do this, you got to do it. On one hand, it felt like this would be amazing. On the other hand, I was like, I'm going to be a single cat lady for the rest of my life. I'm going to dedicate my whole life to teaching. I just I don't want to practice pros. Like, not that I
Yeah,
don't like restorative, but I kind of felt like you did. Like, I love
yeah,
what I do.
yeah, yeah,
So, yeah, but
absolutely. Yeah, I think he'd be a good one.
Dr. Esty.
Yeah.
Uh,
Plus, I haven't seen him in so long, so I just want to watch him.
I haven't seen you in so long. 10 years, dude.
I know. It's
Not cool.
crazy. Yeah. It's been too long.
I know. Okay, so I will see you soon.
I know, because last time you saw, they were like, yeah, a couple months old.
They were babies. I could hold both of
Yep.
them. I was doing like
Yep.
workouts with them.
Yeah. No, the oldest is in middle school now. Yeah.
Yeah.
Just
That's,
finished sixth grade today.
oh gosh.
Yeah.
Yeah. That's like I'm like on the phone
Yeah.
with him. I got to
Yeah.
spend a lot of time with him when he was in college out here, and
Yeah.
obviously I help him a lot, and then just like reading some essays and everything, I'm like, huh.
Yeah. Yeah. Yeah.
There's a lot of
Yeah.
thoughts.
Yeah. He's not 8 anymore.
No, it's so crazy. Even yeah. But it's so awesome, and
Yeah.
it's really cool to see everybody grow up, and yeah.
Well, that would be nice to get down there and maybe try to get with Kyle and stuff and the family and get out by you.
Yeah. Oh no, we
Just
gotta go to Kyle's. He has the pool, awesome
nice.
house. Yeah.
Perfect.
Yes. All right, friend. Hang on one sec. I'm gonna turn it off on this end. Okay. Wait, as you can see. No, flip.
So you got a little studio.